Hello, I'm Mary Ruth Sarsfield. Welcome to the Senior Report. Now, everyone agrees that walking is a safe and healthy exercise, and it's certainly one of the best forms of exercises for seniors. So let's be kind to our feet and take them to visit a podiatrist, such as my first guest, Dr. Sheldon Nadal. Dr. Nadal, why do we as seniors have, or seem to have, more problems with our feet than other people?
Well, May Ruth, over the years, problems that you haven't taken care of become cumulative. And many foot problems can be progressive. So if you haven't taken care of them early on, they get worse with time. The other thing you have to remember is as we get older, your circulation gets worse, and that can magnify problems.
But what are some of the most common problems that seniors have with their feet? Circulation, or?
Well, circulation is a common problem with most seniors. A lot of seniors have problems with their toenails. They can become thickened. A lot have bunions, corns, and they have calluses.
And poor circulation.
And poor circulation.
What causes that?
Well, as you get older, you get so-called hardening of the arteries. What happens is things that are in the bloodstream get laid down along the inside of the arteries, and that makes them smaller and smaller. And so it gets harder for the blood to flow through them.
Well, isn't that strange? You know, when should you go to a podiatrist? After you start feeling that, you know, your feet are cold, or when?
Well, if you have any kind of symptoms, such as cold feet or pain, you should definitely see a podiatrist. If you have any deformities, such as bunions or hammered toes or ingrown nails, those are other good reasons to see a podiatrist. I think, though, at a certain age, you should go at least once a year. That way, we can check your feet and make sure everything's okay.
That's right. What are hammered toes? You just said if you have hammered toes. What are they?
A hammered toe is a crooked toe. Instead of sitting nice and flat, it's sticking up like a hammer, and the shoe tends to rub against the toe, and that can cause corns on top of the toe.
But that's like a bunion, isn't it?
Well, a bunion is a deformity of the big toe joint. The big toe joint becomes enlarged, it sticks out, and the big toe presses against the second toe, and it becomes very difficult for people to fit shoes if they have bunions.
What can you do about that?
Well, in many cases, we can correct them surgically. We can do that under local anesthetic, and that's a really good procedure for seniors because they can walk right away. And that's important because we don't want seniors lying in bed. When that happens, they can develop problems with their circulation, such as phlebitis.
Yes, yes, and that's frightening. I think not enough seniors are aware that surgery can correct, you know, these things which seem small at the beginning. You mean if I come in off the street or make an appointment with you, you can actually do mild surgery and then I can walk out again?
We do, podiatrists specialize in a type of surgery called ambulatory foot surgery, which allow our patients to walk immediately. We can correct bunions, ingrown nails, hammered toes, and corns with this technique.
That's excellent. Well, tell me, if I just have cold feet, because we talked about circulation, and in the cold weather, what should I do to get rid of cold feet in cold weather?
Well, cold feet may be due to poor circulation, and there are things you can do to help. One of the best things, as you mentioned, is exercise. Walking helps to stimulate the circulation. It helps to get the blood flowing, and it'll also help the veins take the blood away from the feet. And when the veins aren't working properly, that causes swollen ankles. So a lot of seniors can improve their swelling just by walking. Another thing, you should quit smoking if you smoke, because smoke has nicotine, and nicotine is what we call a vasoconstrictor. That means it makes the blood vessels become smaller and smaller. So again, it's harder for the blood to flow through the arteries to get to the feet.
Apart from all the other problems, seniors who smoke must realize that it's going to come out on their feet, and the problems they're going to have with their feet.
That's because the feet are the farthest away from the heart, so the blood has to go the farthest to get to your feet. You want to do everything you can to help your circulation. If you smoke, you should quit.
That's interesting. Now, I also want to know, because it seems to me that older people often complain about cramps in their feet. You know, the bottom of their foot is cramped up, and it's painful.
That's true. Cramping may be due to circulation. Other things that will cause cramping is a foot that's not balanced properly. If your foot needs more support, the muscles have to work harder. that can result in cramping. If you get cramps, a lot of people get them at night. What you can do is grab onto your toes and pull them forward toward you. Grab the front part of your foot and the toes and stretch them toward you. That'll stretch the muscles on the bottom of the arch, and at the same time you can rub the muscles, and that'll help to soothe it, and that'll help to get rid of the cramps.
It's so much information. I'll tell you what. Let's have a quiz so we can see if our viewers remember some of the things that you've talked about, and that way we'll lock in the information.
Great. I hope I pass.
I hope I pass. Well, all right. A definition of calluses. What are calluses? Bruises that result from stubbing your toe, families of operatic singers, or areas of dead, thickened skin.
I almost would have picked B, but the true answer is C. Calluses are thick skin which build up due to pressure and friction.
Tell me the second question. Your body produces a callus to cushion the bone, or in places where it's rubbing against it, which is sensitive, or does it produce calluses just to annoy you, or to provide a way to protect or to predict the weather?
Well, calluses do annoy you, and some people with arthritis can predict the weather, but the correct answer is A. Calluses form to protect bony prominences.
Okay, but I hope the people at home are deciding what their answers are. So the third one is most calluses are found on the sole, the ankle, or the moon.
I don't think it's the moon. I think the right answer is the sole. Thickened dead skin on the ball of the feet or on the sole of the feet are calluses. When you get it on top of the toes, we usually refer to those as corns.
Okay. You can tell it's a callus when it is always, sometimes, or never painful.
I would say the answer is sometimes. Some people have calluses that don't hurt. Some people have calluses that hurt. When they hurt, that's when you should come in and see us.
Okay. And calluses are caused by improperly fitting shoes, eating too much frozen yogurt, or is it a biomechanical foot problem?
In many cases, Mayruth, it's due to improper biomechanics. That means the foot isn't balanced properly, and that causes pressure at the ball of the foot, and that's what causes the calluses.
And treatment for a callus, would it include periodic removal of the dead skin, wearing a prescription or orthotic, and that's an insertion in your shoe, or would it be surgery, or would it be all of the above?
Well, periodic removal of the dead skin will give you temporary relief, and for some people that's all they need. If it's due to a mechanical imbalance, if there's a pressure point, orthotics can help. If you still have problems, in many cases we can correct them surgically.
Well, we're unfortunately running out of time, but tell me, in terms of shoes, what is the best way not to abuse your feet?
Well, I think the best shoe available are good running shoes, such as, for instance, a Nike or a Reebok or any of the better made running shoes. What you should look for is at least 2 layers in the sole. A hard outer layer so it won't wear down quickly, a softer inner layer for cushioning, and you should have a firm counter. That's the part that cups the heel. By holding the heel firmly, it gives you more support.
Dr. Nadal, you're going to turn us all into yuppies running around with our running shoes, but what good running shoes and what happy yuppies we will be taking better care of our feet. Thank you for joining us.
My pleasure, Mayruth.